Good afternoon, everybody. Thank you. For everyone, please grab a seat. We are excited to start our post-lunch panel, which I know I am extremely excited about this panel. My name is Ben Fulgencio-Turner. I'm the director of the Climate for Health program at Eco America. We're so proud to be one of the co-hosts for this incredible convening. I've been so happy with the content and excitement and energy coming from each of these sessions, the ways that people are leaving with things to take back home and take action on. So I'm really hoping that everyone else is feeling the same way, that they're going to go back to their homes. We're going to attack the hill tomorrow, have our show of force, and then we're all going back home and have things that we can unwrap and implement back home. So really excited for this panel. It's going to get everyone out of the post-lunch sleepiness and right back into the role of the conference. So this panel is advancing pediatric health in a changing climate. We know that children's health is a core value for people and a priority for people across the political spectrum, across the country, across demographic groups. It does not matter where you are, where you live, who you are. You care about children and their well-being. And this group is going to talk about the ways that there are innovative solutions and actions to protect children's health and to really mobilize health professionals and that voice for children's health as central to this movement. So I will invite the panel to come on out, and our moderator today is the executive director of the Children's Environmental Health Network, Nsedu Witherspoon. So let's give them all a big round of applause.
Thank you, Ben. Hey, everyone. So please feel free to stand up in the spirit of public health. I know it's rough when a really good lunch starts digesting. So let's make sure that because this as we have been all morning, this is definitely proving to be, I think, a good, robust conversation. And I think Ben framed it really well. Again, Nsedu Witherspoon, or Nse, I'm the proud executive director of the Children's Environmental Health Network. We are a national nonprofit also doing global work and also some state work around just simple mission of protecting all children from environmental hazards and the growing threats of climate change. We conduct our work by stimulating and activating in peer-reviewed science, children-centered science, preventive science, we call it. For example, we are the national coordinator of the Children's Environmental Health Research Translation Program. Of course, that's a government program, CERT, funded by the NIH in 6 different centers across the country. We take a lot of research, world-renowned research, and translate it. That's the heaviest part of our work into effective programming, education programs, technical assistance, and training. For example, our Eco-Healthy Childcare program, and also work we're doing in childhood cancer prevention, just to name a few. And we provide leadership on a variety of advisory committees and groups and boards. And we also take our mentorship role really serious. And I would encourage all of you to think about how can you continue to lend a hand to the generations behind us. We didn't get into these crisis moments overnight, and even the elevation of it in the last month or so. We will not get out of them overnight, and we certainly need the power of everyone. So we have internships. We also have a summer fellowship that we conduct with the National Center for Healthy Housing. So I'm here today in my capacity as a public health trained professional, as a mom to 4 children, which is probably the hardest job out there, and a seriously fierce advocate for our most vulnerable. Our children have done nothing to get us into these cycles of harm that we are in, and they bear the brunt of, but they are here, and they deserve our respect and our dedication to make sure that their lives are as fruitful as can be. And we all know, we've been hearing all weekend and into today about the extremely serious, unprecedented historical moments that we are living in. And I really appreciate what we heard in the lunch. I know I needed to hear a reminder about how to ground ourselves each and every day, because that is part of the tactic. And we have to be real about the mass layoffs to our federal workforce and that trickle down to what it means at our states. We have a lot of our public health workforce and agencies that are reliant on federal funding, even at the state level. The freezing of equity, climate-related, and community-focused funding, just to name a few, is already being felt, and it is really unfortunate on many levels. The attacks to non-governmental leaders in particular, women, those led by people of color like myself, with no other basis than just that you're doing work around equity, justice, and climate, and even public health. And even proposed threats like 60% of layoffs of the EPA, which along with the CDC also is a prime public health agency in the United States with a clear mission to protect the public's health and environment. So I'd like to know, how do you reduce the workforce by less than half and still even begin to protect what we've worked so hard to do? Water, air, food, built environments. These are basic exposure routes. And of course, every environmental exposure pathway is only exacerbated further by the crisis and threats by climate change. And with that, I want to offer that there are opportunities. We didn't ask for this moment, kind of like the COVID pandemic, and yet here it is. And anytime you have this moment in history, these cycles of history repeat themselves in a different way with different people. We have these very low times, and then we rise up as a society and community better than where we started. At least that's where I'm choosing to go. So we have an opportunity to position children's environmental health as a key leverage point in this work. At the end of the day, again, it's not genetics that childhood cancer is rising every year since 1975. We have reports with our partners to show it's pesticide exposures, it's pollutants from vehicle emissions, it's paints and solvents are part of the risk factor. It's not the only. So that speaks to occupational exposures, but you don't really hear that much when you talk to cancer-serving organizations. We have an opportunity to lean on real information versus false narratives and propaganda. The Environmental Protection Network, if you don't know about it, these are retired or former EPA professionals who've decided to give their pro bono time to provide technical assistance, advisory capacity, and serve as a liaison to connect people. They have totally ramped up right now, and they did a poll right after the last presidential election of all voters, and resoundingly, there is high support in the 70th percentile for the Environmental Protection Agency, for their budget, and not only that, but to increase their budget. So again, a reduction of their workforce, for example, is not in sync with what the rest of the public is looking for. We need to also continue to remind ourselves that the vast majority of the public acknowledges that climate change is actually happening, it is real, and that we as humans have been a big part of that. There is no discount. We're past that discussion. Where we are now and where the fragmentation starts is, what now are we going to prioritize to actually get it done? And are we going to prioritize health and the well-being of our most vulnerable, something we've never ever tried to do? We also have an opportunity to challenge ourselves to ensure that messaging is appropriate. Messaging is so critical, right? We've been hearing this, and it is tough for researchers and even those in public health to right size. We don't necessarily all have these amazingly well-funded communication firms, right, to work with us to do this. So it's yet another level of responsibility to really make sure that we do our homework. Who are we trying to reach? What are the leverage points that we truly believe are going to resonate with them, just to get the foot in the door, and then we go from there. So we also have an opportunity to demonstrate how our existing programs and platforms can be elevated to identify and demonstrate the benefits of climate mitigation and adaptation. So our Eco-Healthy Childcare program is one of a few programs that are already existing, has a well-established foundation. We've got a great network. And now we can also engage those childcare professionals, owners, facility managers who are taking care of any child from 6 weeks to 5 years of age when cognitive learning is happening, to help them also think about energy efficiency, no idling policies, which cost nothing, low to no cost things that they can do to demonstrate to themselves and the families they're serving that there's also much better ways that we can do this by helping the climate and environment and public health at the same time. So this session is going to focus on the latest evidence and strategies for addressing the impacts of climate change and pollution to children's health. And our panel will speak on practical tools and effective communication, actionable interventions, and opportunities to ensure in efforts to mitigate health risks and promote resilience in pediatric populations. I'm going to introduce our speakers. They're each going to speak for about 7 minutes, and then we're going to go into some questions. Dr. Shreya Doshi is a third-year pediatric infectious diseases fellow at Children's National Hospital here in Washington, D.C. She attended medical school in Mumbai and is currently pursuing her Master's of Public Health in Global and Environmental Health at my alma mater, the George Washington University, and alongside her fellowship. She will be presenting on a perspective of health systems in action. Our second speaker is Almeta Cooper, the National Manager for Health Justice at Moms Clean Air Force. Her work holds a specific focus on climate, children's health, health equity under the umbrella of the Community Health Equity Program. Almeta's work on clean air and climate justice issues for moms is a natural progression of her 30-year career as an executive attorney and advocate for organizations focused on healthcare, health equity, and women and girls. Almeta will be providing her perspective on community activation. And then finally, we'll have Dr. Lindsey Burghardt, is the Chief Science Officer at the Center on the Developing Child at Harvard University, where she develops and leads the center's scientific agenda. She is the founding director of the center's Early Childhood Scientific Council on Equity in the Environment, a multidisciplinary group that synthesizes and translates scientific mechanisms related to the many ways that the built natural environments impact children's development and lifelong health. And Lindsey will be providing a perspective on new research opportunities. Thank you very much. Shreya.
Good afternoon, everyone. I'm so honored to be here today and discuss a subject that is both deeply personal and universally pressing. I'd like to begin a little bit by sharing about my background. Growing up in Mumbai, I practiced Bharatnatyam, which is a South Indian classical dance style. And before every dance session, we would do a humble bow down to the earth, a powerful reminder of our deep connection and respect for nature. When I returned to Mumbai after pediatrics residency, I was a little heartbroken to see firsthand how air pollution was affecting the health of our children. But at the same time, I was also reassured to see how a lot of young people in India were trying to change that, to mitigate that by coming up with innovative solutions around air pollution. And then when I started my infectious diseases fellowship, this was the very first week of being on service, so I can't forget this patient at all who changed how I think about climate and health. So we'll call her Zara. Zara is a 10-year-old who lived in Virginia and visited Pakistan in the summer of 2022. She was diagnosed with extremely drug-resistant Salmonella typhi bacteremia. What does that mean? That means that all the first-line antibiotics that we have to treat Salmonella typhoid would not work for Zara. So we had to put her on carbapenem. A carbapenem is a very broad spectrum antibiotic. So we had to put her on meropenem for several days. And she did get better eventually. But when she was about to, we thought, okay, maybe we can send her home now. But what happened is we didn't have any oral antibiotic options to treat her with because of the drug resistance. And guess what makes drug resistance worse? Climate events. So both extreme heat and floods can make drug resistance much worse, amongst many other factors. So I was seeing Zara and taking care of her in front of my eyes. At the same time, I was reading the news about how in 2022, Pakistan had the greatest, most massive floods of all time. 2/3 of their country were submerged under flood waters. And I started thinking how this flood is going to further impact drug resistance and what tools do we have to treat. Like generally people come to infectious diseases to brainstorm when there's a diagnostic conundrum or you're running out of treatment options. And unfortunately, after the carbapenem, I don't have many more tools in my toolbox to help this kind of drug resistance. So that was the point that I realized that there's an urgent need for a focused initiative at the intersection of infectious diseases and healthcare sustainability. So one way that I find joy is by mitigating healthcare-related carbon emissions through Sustainable ID. So Sustainable ID is a research collaborative that we created for infectious diseases providers that integrates environmental stewardship into infectious diseases clinical practices. And the argument that I generally make to all my ID colleagues is that no matter what you're interested within infectious diseases, sustainability can be a part of your work. So whether it's antibiotic stewardship, diagnostic stewardship, if you work in a lab, decreasing lab waste, if you work in the outpatient setting or HIV care, no matter what you're doing within infectious diseases, sustainability has a role. So we started with about 2 members 2 years ago, and now we have about 220 infectious diseases providers on our listserv. And what we're essentially trying to do, thank you. Thank you so much. And what we're essentially trying to do is infuse sustainability into every infectious diseases professional society out there, into every infectious diseases related conference, So this year, some of our members are going to talk at Shreya, at Pediatric ASP conference, at CleanMed, at ID Week. So we're really trying to get the word out there about sustainability in infectious diseases. And as you heard at the previous session on plastics from Dr. Singh, he mentioned it 3 times that infection prevention and control can be a great ally for you at all your hospitals when you're trying to do sustainability work. So that is why we want to work on this at the grassroots level. So Preeti Jaggi, Preeti, let everybody see, raise your hand so everybody can see your face. So Preeti Jaggi is my research mentor and research partner. She's at a different institution, but both of us got together and we started Sustainable ID together. And I want to say that having an incredible research mentor, partner, somebody who can champion you, can provide sponsorship, is so crucial in these times, because in my experience, finding a partner in this kind of research work with somebody who shares your passion, understands your struggles, and celebrates your progress can really transform your sustainability research journey. So I'm very thankful that I have that kind of a research partner. And now we recently published a series of articles with the Journal of Pediatric Infectious Diseases and Open Forum Infectious Diseases on all these topics. So whether it be green infection prevention practices, antibiotic waste, lab waste, and along with this supplement, our professional society, the Pediatric Infectious Diseases Society, also made a statement on why climate and health and sustainability are pressing issues of our time that need urgent attention. So I just wanted to highlight how, this is an example of how we can be a part of the solution by starting small, finding a partner, finding a community to do all this work in, and just keep going and being persistent.
Thank you.
Thank you.
Thank you so much. Almeta?
It's really a pleasure to be here with all of you. As was mentioned in my introduction, I've spent in my first half of my career, I was a general counsel in healthcare organizations. So I started at the AMA in the Office of the General Counsel and worked with LCME and ACGME. I was the first legal counsel for those organizations. And then after that, as I said, I've been in other medical schools and healthcare centers. So it sort of comes naturally to me that when I started doing the work that I'm doing now in terms of climate, that my focus was related to health and really trying to help everyone, people in the health professions as well as lay people, to really make the connection between health and climate. So at Moms Clean Air Force, we have about 1.5 million moms, dads, and caregivers, and we're focused on children's health and clean air. And of course, there are a lot of things related to that: clean air, clean water, healthy environment, and we engage in all of those things, but our main focus is with clean air. And what we really try to do is that our mantra is that taking action is what every person should be doing. So I've been sort of inspired and energized by the discussions that I've been listening to yesterday and today. And I decided to sort of change what I was going to talk about a bit, even though I'm the person on the panel who's really trying to make that connection between what lay people can do and how we can elevate the message. So one of the things I wanted to say is that for moms, one of our big things, in addition to taking action and telling elected officials, we're on, social communication, and social media has been our strong point, as well as giving testimony and with the EPA and with and being on the Hill. So I decided I would be maybe helpful to kind of maybe bring to life what we're doing, to have a little bit of a show and tell. So one of the things you might notice is that whenever you see someone from Moms, we are really into branding. And on the Hill, we get a lot of comments about the fact that generally when we are doing Hill days, we are in our little red t-shirts, but we always have something that really emphasizes that we're from Moms Clean Air Force. And one of the things that given the current environment that we're in, you may not be able to see this well from where you're sitting, but what this says is mom partisan. And what we're trying to, because we go everywhere we can get our foot in the door. We talk to Republicans and Democrats and whoever is going to listen, because one of the things that we've been saying lately is we don't know anyone who ever voted for dirty air for children. And it's really hard to get someone to push back when you say that. We're like, well, they're like, yeah, I guess that's true. So we know that's not really, what we do. So the other thing is that Moms has been around for about 13 years. And one of the things is that we have a relatively small organization. We have 17 field organizers. When I started with Moms, I was first the Georgia field organizer and got a chance to work with Preeti and some of the other people here in the audience. Excuse me. So we really focus on plain language. We believe in science and the evidence that shows that there is a change in climate. We understand that there's climate change. One of the things that Nsedu mentioned, and it's been done through research done here at George Mason in the Climate Communication Center and in the Yale Center for Climate Communications, most people, regardless of their political persuasion, accept and understand that there is climate change. They, like I said, they don't want dirty air for their children. They do want to have clean air. When you show them information in a way that is in plain language, they can get it. So last night I got the inspiration to say, like, we're doing all this social media. We're on X, we're on Blue Sky, we're on Instagram, we're on TikTok, and we're on YouTube. And just by coincidence, because of the panel on plastics this morning, I had decided last night that I wanted to show you a video. It's just a minute and about a minute and a half of the kind of communication that we're doing. And this video, which was on YouTube, has gotten 400 views as of, I think it's been up for about 3 days. Now you're probably saying to yourself, oh, you got 400 views? That's not a lot. The average number of views on YouTube is 5. So we're pretty excited about this. So if we could please show the video. So I think this just really epitomizes the message that we are trying to make. We are trying to get across in simple words based on facts and science that we need to make a difference and that each of us can do it. And you would be surprised when we talk with our friends and neighbors who are members, who now have become members of Moms Clean Air Force. They really didn't realize that they could just send testimony to the EPA, that as long as they knew that there was a hearing, occurring, that they could do that. And we help by providing toolkits and empowering people to raise their voices. And what we found is that regardless of the audience, real people who are affected right now, not in some distant future, by what's happening with pollution is really meaningful. And it can change people's minds and hearts, and that's what we're aiming to do. In 2025, our priorities have been working with all Congress people and specifically with congressional champions for our cause. We are still going to be communicating with EPA on oil and gas operations, soot, power plants, mercury, petrochemical facilities. We are going to go strong as we can at state and local level because, like you've heard from other speakers, we think that is where our greatest opportunity may be for the next several years. And we are not giving up on, and we're still very, very strong advocates for justice in every breath. So we are focused on Black and brown maternal child and child health, tribal communities, and the impacts of pollution in those populations. And we have a branch of our organization called Madres, which focuses on the Latino community. And we have a lot of our publications are in both English and Spanish. And then whatever other urgent national campaigns may be coming up. So as the national manager for health justice, I myself have been focused on electric school buses because, carcinogenic tailpipe emissions can never be good for like the 400,000 children who are riding, the iconic yellow school bus. And about 60% of Black and brown children who live too far to walk to school are riding in school buses. So we chose electric school buses as a place where we could focus on because of the big impact on children's health. I've talked to you about Black and brown maternal and child health. The statistics, as you know, are not good in terms of maternal health in this country, and they're even worse for Black and brown pregnant people. So that has been an area that we're focused on. We're also partnering is one of the things that we love to do, and we've partnered with Nsedu and her organization. We've partnered with MSSSCH, and Children's Health Month is one of the areas where we really like to make sure that we can get our message out, and that's one of the areas that I focus on. I've mentioned to you that I do testimony whenever I have the opportunity in EPA and Congress and other settings, and talk to community groups. And I also focus on partnerships and collaboration. So we believe, just to say in short, what the message that I take to any audience I speak to is be informed, talk about it, because again, as I mentioned before, the research shows one of the problems about air pollution, climate, as it relates to health and to our children is that we're not talking about it enough, and then to take action. And we are providing through moms petitions, talking with elected officials, talking with communities, and expanding the message. And if we can get people to do that, I think that that's a really great start.
Thank you so much. Thank you so much, Almeta. We really appreciate Mom's leadership and continued resources available for all of us. And please, Lindsey.
Thank you. That's a tough act to follow. You're good. I want to know where I can get those buttons too. I feel like raise your hand if you want a button. So thanks for having me. I'm excited to be here. And I was asked to speak in particular about a very cool research project that I cannot take credit for, but I'm involved in. It's kind of a joint effort between the Center on the Developing Child, excuse me, I'm getting over what I'm sure we're all getting over, the Center for Climate Health and the Global Environment at the T.H. Chan School of Public Health at Harvard, and the Frameworks Institute. And if you don't know the Frameworks Institute, it's a very, very cool nonprofit research think tank. They study a range of issues related to things that everybody in this room cares about, particularly like how do you communicate them effectively. And so this is a joint project. The senior researcher, Dominique Liu, was kind enough to allow me to present the preliminary results of the finding, which was informed also by an advisory board that includes a lot of the incredible thought leaders from people in the field that are in the audience today. So this first phase has just wrapped up. We're hoping to start the second phase later this year. There's some funding conversations happening. The first phase of the project was really exciting, actually, and the first part of it was actually going out and doing really in-depth, wide and deep surveys to understand public mindset and opinion. And so this is different than sort of opinion polling, but it's really deep mindset understanding about the way that people think and how people think about the connections between climate change and early childhood. And so spoiler alert, they don't think about it right now. So thank you for being here today. So the first thing that we found really is if you ask people, is there a connection, do you think there is one between early childhood and climate? They say, oh, I hadn't actually really ever thought about that. But that, I think, is a great opportunity, right, for us. If they did understand that there was some ability to name that there's immediate health implications, so they understood, that when wildfires happen or when hurricanes happen, that there's some effect on children. But actually, there was not really an understanding about the longer-term developmental impacts of what it means kind of over children's life course to be affected by some of these climate risks. Probably because of your good work and a lot of the work of people in this room, they actually really could name air pollution as like the way that climate affected children's health, but there was really not an understanding that heat or water or wildfire smoke in particular, like other things that we might in this room name as being issues were actually things that were affecting children already. And then there was some really interesting findings related to pregnancy because we're looking specifically at pregnancy in the first few years of life. So people could name like, yeah, what happens during pregnancy, that can get through the mom and affect the baby. But actually in that, what was lost and not understood was that there was an impact on the pregnant person. And sort of there was a separation of understanding things get into fetal development directly, but not really an understanding of if during pregnancy you're exposed to these climate hazards, what does that do, both to that person and to the health of the child? And then there were not many connections made between how the effects of racism, particularly structural inequities, compounded the effects of climate change. But interestingly, people were aware of and could name that children who had fewer socioeconomic resources were likely to be more affected. So again, like I'm sharing these because I think they're opportunities for where we're likely to see abilities to change and improve our communication. And then interestingly, right now among the public, they put pretty much all of the responsibility for addressing the effects of climate change on parents. So they really see the role of government and of business and other secondary places is really not on, not high up there on the what we need to do list. And then this was really interesting to me, actually, that the solutions that they name, if you say, like, what can you do? What do you think we can do to help protect children from the effects of climate change? There weren't specific ideas that kind of uniquely considered the needs and the developmental sensitivities of kids. So they tend to call in very technological fixes. So they would say, like, we should all recycle, which totally, right? But not that way. But so it was sort of a default to these kind of more general solutions, not things that really honed in on what kids specifically needed. The second part of the project, which I found really interesting, was how we as a group are communicating about this right now. So people who are already out there talking about climate change, talking about children, how do we message this? Right now, we tend to focus on the unique vulnerabilities of children, and that we'll learn about, again, how much that might be a double-edged sword, because we found that when we call into some things like kids are affected first and worst, things that I think we all might call up with some frequency, that actually tends to separate, especially in people's minds, how connected children's well-being is to the well-being of their caregivers, and actually how interconnected all of our wellness is. So it sort of puts kids out in people's mind in sort of this separate group or separate column over here, when really it might be helpful to use different language that calls into mind the effects on caregivers and the effects on all of us, because again, children don't happen over here on their own. A really interesting part of the research was an analysis of the media discourse and sort of a field analysis of how the media talks about children's health and climate change. And I found this to be fascinating. So the frameworks looked at all online studies or online articles, like in the news media from October 2023 to October 2024. There were that mentioned climate change. There were over 2 million. And then they looked at all tweets during that time. I can still say tweet, right? Even though it's X, I still not cool enough. And there were over 4 million of those. And only 4% had any mention of children. So this is even among articles about climate change. And less than 2% of those talked about children's health and development. So they were more about, kids' own climate anxiety, not the effects of, all these other cascading things that the people in this room talk about. So the best part of these initial findings were sort of some emerging recommendations that I can share today. Please, like when you talk about climate change, talk about kids. And that may seem obvious, but I think naming them as a specific group that's really affected is really, really important. And also highlighting that these are present impacts and not just future risks. So kids, I think, are often called into throughout their lifetime, in the future, we're leaving them this, but actually we all know that these effects are already happening now. And so they're really important to name and describe. And then thinking about describing the developmental impacts and not just immediate health risks. So for me, this comes into play a lot of times when we think about prenatal effects and how that impacts health and development across the life course, solely from the implications of being born too early or too small, which we all know can happen from heat or wildfire smoke or all these things. Like being born premature it's not always great in the moment, and it also has implications for learning, for health, for development, across a child's lifetime. And then making really explicit some of the connections between not only children and the effects on them, like those health effects in the moment, but how important those indirect effects are, because we found, the frameworks found that those are not really well understood or well described. And what this means is that people aren't really hearing about how if your house burns down in a wildfire and your caregivers are displaced, naming and being really specific about what those indirect effects are on children's health. So if your parent can't go to work, they also can't provide your food, your shelter, your basic needs, routines that really benefit early brain development. They are less likely to be able to get you high quality food or access to healthcare to maintain an on-time immunization schedule. So we're just not being as explicit, I think, as we could be about some of these things now. And then also finding that we're not talking necessarily as much about the causes of climate change. This was another finding, as we are about the health effects. So we're pretty good at naming all the bad things that happen to kids as a result of climate, but we're less likely to call up the root causes and drivers. And so I think that, and then finally naming solutions that are really specific that address the unique developmental needs of kids.
Thank you all so much. Really critical information. I'm seeing all kinds of questions coming in. We do have a few prepared, and I think we'll get to a few for sure. So with a great deal of propaganda around climate change circulating and pushback, even though many have been reaping the benefits of funds even provided in the last administration that have been working on climate implications, and obviously related funding and staffing and oversight, where do you see the gaps of information? We're acknowledging that there's a lot of information available even on health that wasn't there even in the last decade. But what are the gaps of information needed and or in research, and what are your proposed solutions? I think it's really important that we identify some of these gaps, but also what might be the way that we prioritize, because there are many of them.
Well, as I mentioned, for moms, we have picked areas where they affect children and where we can use kind of the concepts that Lindsey was just talking about, like with electric school buses. So many people are aware of how many children have asthma and how, they know about the air index. And so they know that they may not actually make the correlation unless you make it explicit, like tailpipe emissions are affecting your child who has asthma. Disproportionate number of Black and brown children have asthma, and you need to be aware of that. That's one of the reasons why electric school buses for children and their bus drivers and all of us who've ever, been in that car line or seen your kids standing out of all those that emissions are coming out. Those are things that people can get. It's concrete enough. So that's making that connection is what we've been trying to do.
Thank you. Any other thoughts on this question?
I think I can talk about it from a healthcare sustainability perspective and lens. So, as pediatricians say often, children are not just tiny adults. So I think that's fair when you talk about healthcare sustainability as well. So for example, pediatric hospitals have some unique challenges that I do see some research gaps in. So a lot of the medication waste that we have it's there in both hospitals, pediatric and adults, but a little more common in pediatric hospitals because what we typically do is prepare doses a few hours in advance for specific weight because it's weight-based dosing. So once I have prepared vancomycin for a 7-kilo child, and then the order gets changed because that does happen with new evolving information on cultures, etc. That vancomycin dose that is unused with the plastic bag and the tubing and the syringe, however it is, all of that is going to waste. So that's one example of how pediatric hospitals are a little unique, and we need better solutions in this space. So I think all of you can go back to your hospitals and ask your pharmacies, like, tell us more about our medication waste, and then talk about it and publish solutions. Similarly, for viruses, we know that, kids under 5, more prone to viral infections. So similarly, our usage of PPE is a little different for children, and we can have more evidence-based and research-based solutions around that.
I think I would add, I'm all discussing a study that came out in Nature last year that looked at excess mortality after hurricanes, and it looked, decades and decades past. For the years after, an extreme wet weather event, there's excess more than the immediate deaths from the storm alone. So, there's 24 deaths from a hurricane, and then if you look for the 15 years after that, they estimated something like 7,000 to 11,000 additional deaths per event than what, that were in excess of what would be expected. And then, I think the study got a lot of attention. The methods were incredible and super sophisticated. And then there was kind of one line in there that said, the group actually that saw the highest increased risk of mortality were infants under the age of 1. And this blows my mind, actually, because if you think about it, most of those kids weren't even going to be conceived for more than a decade, right? And they still had excess mortality. So it was like an event, and then if you were born like 15 years after that event, you still had excess mortality as an infant. And so I think we understood a lot in sort of like the fractionated analysis about the different causes of adult death and the reasons why my adults might have more mortality, everything from access to medications, to increased MI, to increased stroke, and these things. So I think really starting to understand these sort of indirect economic implications, the implications of when society is increasingly fragmented, what it means for your social network to be fragmented in the 10 years before you conceive. I think all these things have really important implications that are really not fully understood now, and I think it's a huge opportunity for really kind of providing the best resilience for ourselves going forward.
Excellent. Really important points and reminders, for sure. I think this question also gets to one online. When you're talking to parents, lawmakers, healthcare professionals, sustainable business, we can go on and on about children's environmental health and the intersection of climate change. At times, we do get resistance, right? Even though it's a no-brainer, it should seem a no-brainer, just starting with children and then making some of the connections, real life applicable connections, but the resistance is clearly still there. It's not the center of our collective work yet. What are some of your advanced recommendations for how you deal with some of that pushback and overcoming, even when it's a very clear connection and the resistance is still there?
Well, I know I've had some experiences where what you hear is, if you're going to have these benefits for children, or you're trying to change how climate impacts children, then there's a cost to that. And so, we're going to lose jobs. And what we try to come back with is that the health of our children is critical, and you're going to have to balance. There's not going to be an absolute, dollar for dollar, but you have to be aware of what the impacts are so that you can make a difference. And the thing, and it's a little corny, but one of the things that I often say is, children are 20% of our population and 100% of our future. So we have to take action.
Thank you. Any others that want to respond to this?
Yeah, I mean, so one of our frameworks colleagues said, during this sort of tumultuous time, the words may change, but the work doesn't. And I think that was something that I tried to hold on to that's been successful for us in having these conversations in different spaces. And for me, one thing that's been helpful, and particularly audiences that might not be super excited to talk to you about climate change, is just being specific about what you mean and allowing science to be your best friend. And so you might not put climate change in children, but I think having a conversation about how temperature affects children's learning and explaining what heat shock proteins are, how they protect important molecules in our brain that lets our hemoglobin work, and letting the science speak for itself in a way that's not emotional, that's not charged, but in a way that is really clear. Because I think that we are really passionate about this work, and I kind of want to shout from the rooftops, like, the wildfires are giving all the kids asthma, but that's a different message to bring to somebody, I think, than saying, these pollutants are very small. When they get into our airways, they activate our immune system, and this is actually what happens. So I think it's a place where really leaning on our expertise and being able to explain what we mean and giving examples can be a really powerful tool.
Thank you. Oh, yes,
I
please.
can add to the parents piece of it since, I'm a pediatrician. We've done a survey where we asked infectious diseases providers about what are the barriers in addressing some of these concerned parents. And a lot of them did acknowledge, because it's a hospital-based specialty, that it's tough to talk about it, because it's so big picture. So when you're focused on treating a skin infection or a bone infection, it might be tough, and it's okay to acknowledge that. But at the same time, I practice in DC, and I see patients who are referred to our clinic for Lyme disease pretty much every week for 8 months in the year. And maybe that is an appropriate time to talk about how because it's a tick-borne disease, and how the patterns are changing because of climate. So I think we can find appropriate timings and settings to educate our parents, because I think educating them and empowering them will enable them to support us, and we can work together.
Definitely. Thank you so much. I think I cannot stress enough demonstration. So meeting folks where they are. If I'm in Atlanta, Georgia, talking about coastal implications may not move me, but talking about flooding in downtown Atlanta with the type of traffic that they have, that's making traffic even worse, that's flooding the aquarium, I might be able to, right? Everyone seems to be able to resonate with drought conditions at times, high winds, extreme storms, flooding, these weird patterns of climate that's happening. But the heat, every summer on record, every summer is getting warmer, and this summer certainly is not going to disappoint. So people know how that's impacting their lives and that of their children, how long their children can go out and play and be a child or not, these type of things. So meeting folks where they are and demonstrating in real terms how this is being seen, and then more importantly, activating their energy from that point on into something that they can do. Something that could take 2 minutes, signing on to a letter if they agree, all the way into much more in-depth activities is our experience. So there are some solutions that are specifically addressing the unique needs of children. But what about the solutions when they're driven by young climate activists in particular? Like, we cannot do this work as adults and not forgetting that there's so much creativity, innovation, lived experience, unfortunately. And let's not forget about the climate anxiety that our younger populations, I have a few in my own home, are feeling. It's very hard to think about their future 10 years from now, considering all the weight of what's on them. So any thoughts on how you all are engaging and working with and learning from our youth advocates out there?
Well, one of the things that we've done at Moms, we have summer interns who've been very active in our programming. And we've also reached out to young people. In 2022, it was actually initiated by some high school students, Resolution 975 that was recommending expanding funding for youth centered climate education and resilience projects that benefit mental health. And we partnered with a group of young students. We did, a press conference. We had a day on the Hill, but it was, I think that the Congress people were really impressed by the fact that it was youth initiated, and we simply supported them, helped them to get to the right forum to be able to get attention to that. So partnerships again.
Yeah, it's really hard to be on the other side of a table and look at a under 1-year-old or a little bit older and tell them that their experience is not their experience. Yeah, thank you. Any others?
I think one thing is actually just recognizing that the youth don't really need our help necessarily. They need us to sort of elevate in a lot of ways the incredible things that they're already doing. And so I'm really trying to make a very conscious effort to invite young people into rooms that I've been invited into. So bring them to the table, invite them to share the things they're already doing. I've also learned that a lot of these really incredible efforts by young people obviously happen in a very local sense. And so I'm really trying to understand, even outside of my climate circle that I love to live in with people in this world, what's actually happening in the community where I practice as a pediatrician, what the kids are doing in the schools, what they're doing in their own neighborhoods and in their homes. And actually when we show up and say yes, we as doctors who love and study climate change think this is awesome and important, I think it's helpful to show, I think for young people, the sense of making a difference and mattering and knowing that your work is important and knowing that your work is seen and valued by other people is really, really important. And I think that that's something that we can bring as people who obviously share their passion.
Yeah, thank you. Oh, please.
I just wanted to add that I've been amazed by the number of medical students and residents that have been reaching out because they want to be a part of healthcare sustainability projects. So one of the things that we've been telling our professional society is you could also use this as a recruitment tool. Less and less people are choosing pediatrics and pediatric subspecialties, unfortunately. So, giving them tools like healthcare sustainability to actually make an impact might mitigate some climate anxiety, and it's a great way to recruit them as well.
Mm-hmm.
And one other thing, last year at this conference, we had the attorney who represented the young people who brought the litigation in Montana, Held versus Montana, because Montana had an unusual situation in that it was very clear in their state constitution, there was a right to clean air and healthy living. And so they were able to be successful based on the state constitution. But that was just a really incredible experience for those young people, and also how it communicated to other young people that there's something that you can do.
Thank you. And there is a question, Lindsey, about where to find the study that you mentioned and referenced.
The Nature study?
Mm-hmm.
I think I'm pretty sure Nature is public access, open access. So if you Google no, someone's shaking no. Okay, well, maybe that's a plug. It's available on PubMed, but if you were to look at, I think I don't remember the exact title, excess deaths from cyclones, excess mortality from cyclones. It was maybe January of 24. Somebody out there probably knows the exact citation off the top of their head, but.
Thank you. And Almeta, where do people get the buttons? That's actually
we want a button.
You want, www.monscleanairforce.org, or you can just see me. I'm here. I'd be happy to get some buttons to you.
Excellent. There are a lot of great questions. There's a question about going a little deeper about the impact of climate change upon pregnancy. I know that we talk a lot about the impact of rising heat index, unfortunately, negative birth outcomes, a lot of concerns health-wise for the pregnancy of the mom carrying out that pregnancy. And then, of course, injury, increased disease opportunities, just like the general public. We already know pregnant women are already a vulnerable population. But what others would you all add as far as making the connection there that we could be lifting up more?
Yeah.
Go ahead.
I think you can think about it by category. So, for heat, water, and air, meaning the effects of probably wildfire smoke in particular, there's pretty clear and emerging evidence that ever growing, I would say, that during times of higher temperatures, we can see increased rates of preterm birth. the evidence is, and there's a meta-analysis on that shows pretty clearly that we'll see more preterm births if temperatures continue to rise. The evidence is less clear, but there's still some connecting effects on birth weight. We talked about earlier, like, being born too small is really important or too early, especially is important because those babies have higher risk of death in the neonatal period, but also infection difficulties, feeding, difficulties with jaundice. They have higher readmission rates to the NICUs. But then I think one thing that's underestimated is, we also see the effects when kids hit the early intervention and school system with higher rates of difficulties with cognition. And these are all not thought of as pregnancy effects, but those babies also hit the adult healthcare system and have increased risk of diabetes and heart disease and a range of other outcomes. And so that doesn't get quantified as an effect of heat on pregnancy, but it very, very much is. So if we were to, there's a good news, bad news there. If we were to weigh in and protect people during pregnancy from the effects of heat, we'd likely see an outsized positive effect, not only on pregnancy outcomes and birth outcomes, but all of these other things that we care about across the lifespan. And the same is true when it comes to wildfire smoke. So wildfire smoke, and there's increasing evidence as well that leads to increased rates of preterm births in periods after fires, again, with the cascading effects. And then obviously those are direct pathways, but also the indirect pathways of what it means to give birth prematurely after a heat wave or after a wildfire event, and the cascading effects that has not only on the health of the pregnant person, but on the baby.
And everything that Lindsey just said, but one other thing I just want to add too is that a lot of people don't really make the connection between the disruption of the provision of medical care during a pregnancy, particularly when you have a wildfire, you have a flood. It really has has long-term impact on that person who can no longer, see their physician, or who may not be able to even deliver as planned in what they had expected to go on. So that's just another supplement to what Lindsey was just talking about.
Thank you. Well, in our last few minutes here, I think it's really important to end on an upbeat. This is heavy, heavy work. There's a huge responsibility on our collective shoulders. And then when you throw on the impacts of the future generation, it makes life a little challenging. I try to get up every day just showing some gratitude and putting forth some positive energy for millions of children that I serve that I'll never meet. That brings me incredible joy just to know that I believe I'm on the right side of history. What brings you all joy in this very hard intersection of work?
Well, one of the things I would say for me is just being around people who share the passion that I have for making a difference and getting the information out. So it's kind of like knowing you're not alone, seeing the impact when we've been able to get a huge number of people to sign a petition, or when we've gotten people, through moms to contact their elected officials. Like right now, and even though some of the people that we were not supporting for being the heads of federal agencies, we were able to get a lot of response from our memberships to contact their elected officials. So when we are making a difference, and that really, every time we have a positive step forward, that gives me the energy to try to think about, like, okay, what else can we do? What innovation, what other way is there to get our message across? That really energizes me.
Thank you.
I think through like quality improvement work, when you actually see the numbers go down, you see the change, it's very tangible. So whether you're working on reducing medication waste or PPE use, you can actually see the difference. And I think that brings a lot of joy. Also collaborating with other pediatricians, because pediatricians are just like an amazing group of people to work with. After we did grand rounds 2 weeks ago, almost like 15 people reached out saying, how can I help? And I think that's great energy right there. And lastly, I think I've also seen change in attitude. So maybe 2 years ago, when I was asking people in infectious diseases, how do I build a career in sustainability? They felt bad, like they were like, oh, I don't know where to point you towards. And now they're like, thank you for teaching me about this and leading the way on this. So I think all those are tangible things that bring me joy.
Excellent. Thank you.
I have this like somewhat cheesy quote taped up on my computer that says, teach your children the magic of an ordinary life. And I try to think about it every day because I think they are kind of bombarded with a lot of things that they could worry about. There's also, no matter what kind of kid you are and where you live, there are different kinds of pressures on you. And so I think the idea behind this is everywhere you go, see if you can find wonder and find joy. And this has been interesting for me as a mother of 3 young kids to try to look at the world and name and be explicit with them about all the places that they can find joy, whether it's like, look how excited your friend was to meet you, or, oh my goodness, look at how cute that bird is. It has blue on its chest. And my youngest child, who's my environmentalist, said to me the other day, I bet you love that tree, don't you? And I was like, my work here is done. but it actually does work, because when you go around looking for all the things that are wrong, you will definitely see them. And if you go around looking for the joy, like when I walked in here, I just said, I'm going to see like how many people smile at me. And it was like everyone, right? And so I think that just because it's easy to get overwhelmed, if you practice it, like our lunchtime speaker was saying, like 1,000 times a day, I think that you can grow and dwell and sort of like bask in that feeling. That's
Excellent. No, excellent. Really appreciate you all have heard some wonderful resources, tools, connections. I think we all would say we would be honored to work with any of you. Children's Environmental Health Day is the 10th anniversary of that incredible day of action this year. It's always the second Thursday of October. That's just one of many ways to leverage the wonderful work that you're all doing. So thank you. It's been an honor to have this conversation.
Thank you again so much to this great panel. Really appreciate all of the wisdom.